Tonight's meeting, I'm going to read the governor's order. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting can do this through Facebook or YouTube. Just to start on the agenda, we have there are no minutes for approval, but Maria, if we can make sure that
Yes.
yeah, we speak to Teresa because I know there's been one or two meetings, so we can discuss that at our next meeting. Councilors, there's no new items, but there are several tabled matters, and Director Armano is here to speak with us on a couple of those matters. Is there any of these items that you would like to take up?
Through you, Mr. Chair.
Go ahead, Vice Chair.
Do you have any in particular item that we would like to take up?
Thank you for the question. So Director Armano is here primarily to talk to us about coronavirus preparedness, kind of like where we're at. But then there were also some questions that we asked of him regarding the Lawrence school openings, and there's some memos that were sent to us regarding that. So
right,
either of these items.
All right, I would like to make a motion to take item 6120. This is the coronavirus launch preparedness.
So there's a motion.
Out of the table matters.
There's a motion by Councilor Rodriguez to take item 6120. It was seconded by Councilor Ana Levy. So we'll do a roll call. Councilor Levy?
Yes.
Councilor Reyes? Councilor Reyes?
Yes.
Councilor Rodriguez?
Yes.
The chair votes in the affirmative. All right, so Director Armano, thank you so much for being with us today. I know we spoke over the phone. I think, in the last meeting, primarily we were asking you to come in so you can discuss to us and let us know how things were going as far as, the vaccine rollout, how things are going as far as, sort of corona preparedness in Lawrence. I know that it's a whole lot lower than it was last year, but we're still in the, we're probably in the top 5, right, of, I think like Lawrence and maybe Brockton are still considered red zones. So that's one piece that I definitely would like you to talk to us about. And then the second piece is, more related to what happens in a couple of weeks when the state order is kind of removed. What happens to Lawrence? Do we retain the local policies, and if so, until what time? And within there, if you could also talk to us about sort of like percentage of folks that are vaccinated and what we're doing to make sure that people are getting the vaccine.
Sure. So let me start with some numbers to answer your question, and feel free to obviously interrupt if you have more specifics about a topic, but I'm sort of shuffling some papers around electronically here with some of the numbers. But to answer your question, yes, Council Payano, the city of Lawrence is high still as far as comparatively to the Commonwealth. We are #1 with cases per day and #1 with percent positivity, which is the percent for our residents who test positive of those who are getting tested. So to give you some perspective, right now the city is over 20,000 cases. To be exact, 20,237 as of about 10 minutes ago when we pulled the data. In the month of April, we were averaging about 38 cases per day. The month of May, we've dropped down to about 16.5 cases per day. So we're seeing a drop, and we're seeing a drop as a Commonwealth, but the city of Lawrence still is at the top of the ticket there. Our percent positivity rate is 4.46. And that rate was as high as 19.77 back in January. So we were at one point in the winter, 1 out of every 5 people getting tested was positive. And now we're at 1 out of every 20 approximately. And we've seen a steady decline in that number. Often a question that's asked is, are we still testing the same amount of people? Are the numbers dropping because we're testing less? And the answer to that question is we are in fact testing about the same people. So in the past 14 weeks, we've tested approximately 550 to almost 700 people on any given week. In March, we were in the 500s, and we just dropped to 560 this past reporting period. And these are all based on, they're captured in a 2-week reporting period, and it's based on average tests per day. So we're testing 560, which is about average, a tiny bit lower. As far as, again, the vaccination, I'll go into that a little bit. Our efforts with vaccination, it's been slow and steady. We are the lowest out of the closest 15 communities, so 16 counting the city of Lawrence. We're the lowest in receiving, I'm going to give you the data based on those residents who received at least 1 dose. So they've either got the Johnson & Johnson vaccine and they're done, or they've started the process in getting vaccinated. So we were at 42.1% as a population. That's the lowest in the Merrimack Valley with those 16 cities and towns. And then as far as the big cities, we're 3rd from the bottom in the top 14 cities in Massachusetts. New Bedford and Springfield have a little bit lower vaccination rate. So that's sort of, it's kind of bad news hearing it that way, but I want to brighten up the news a little bit here. Again, 42% as a population, as most of you know, counselors, our population is rather young in the city of Lawrence. So although we had some struggles getting a lot of people through these mass vaccination sites for a number of reasons. One, they weren't quite eligible. Another one, all of the many social determinants that we face in the city and gateway cities also struggle the same. We had a difficult time just giving people opportunity and access to the vaccine. So as you know, our population, we work 1st and 2nd shifts. Unlike other populations, we may not have a laundry in our units, and we may have to travel, and that takes more time, or take a commuter rail that takes more time, or take a taxi that takes more time. There's so many things that affect how I could go on and on, why it's so difficult for our population to reach a vaccination site, not to mention the barriers of just communication and getting this information out there. And just the fact that sometimes we work so hard as a community that there's no time to even watch the news, things that we often take for granted. So we knew we had to do a lot of hard work to reach our residents. We knew we had to really get in there, go door to door, go at multiple opportunities. So we weren't surprised in the beginning that it was a slow start. With that being said, for the first time in about 11 or 12 weeks, we're starting to outpace the Commonwealth in the percentage of our population that's getting vaccinated. So we were vaccinating about 3%, 2.5% to 3% every week. We're still at 2.4%. Whereas the Commonwealth is dropping a little bit what it's doing. We've also, because of the eligibility factor, again, our population is young, we crunched the data a little bit more, and I think you'll be pleased with 3 highlights I'm going to tell you right now. So looking at our eligible population, the first thing I want to point out is our 12-year-olds plus. So anybody in our community who's 12 years old or older, those are the eligible people. Over 50% of our eligible population has received 1 dose, which I think is a fantastic number considering we just opened up to our 12 through 19 population. Over 80% of our 50-year-olds plus, so anybody who's 50 years old or older, 80% of those people have received at least 1 vaccination, which I think is another phenomenal number. And then I'm 65 plus, my last stat that I'll throw at you, 85% of our 65 plus population has received at least 1 dose. So we're well on our way. Obviously, the national goal is to have a 70% vaccination rate. And the Commonwealth is doing a phenomenal job with one of only 8, I believe, states that have a vaccination rate of 70%. But we were a little bit behind. We were a little bit slower, but we're finally getting to that place where we're able to vaccinate people. How we're doing it, when we're doing it, we're doing it in a variety of different ways. We have Greater Lawrence Family Health, who has a clinic here in Lawrence. We have Lawrence General Hospital that is operating at our South Lawrence East location. They're cutting back a couple days just to Wednesday through Saturday. And then we, as a municipality, as most of you know, we started a municipal clinic, and we started to take that mass vaccination site and split it up a few different ways. So we now have our location at the Arlington School is going to remain open. It's Monday through Saturday. It's 9 to 5. Anybody can walk in. And again, I'll emphasize it's walk-in, not by appointment only. They can walk in 9 to 5 Monday through Saturday in the Arlington School, which is our most dense population in the city. They can come to City Hall now from 8:30 to 4:30. We have a small vaccination pop-up right here at City Hall, and they can come actually Monday through Saturday, not just Monday through Friday when City Hall is generally open. And then we have a pop-up clinic, and we do a pop-up clinic every day. And this is one of the things that I think has been the most effective. The pop-up clinic, I guess the theory behind it is we need to engage the community. We need to have other people, other community leaders take ownership of our vaccination effort. So we asked business leaders, organizational leaders, leaders of even people who run and operate housing units to come to us and host a clinic. And we want them to bring the people. We bring your customers, bring your residents, bring anybody, your friends, your family, anybody who's in our community. Tell them what's going on. Tell them that you're proud to get vaccinated and you're getting vaccinated, and we'll bring the vaccine. So we've been doing a pop-up every day. We're encouraging our community again to reach out to us if they're interested in hosting one of these. And we have one scheduled, I think at least one probably for the next 3 weeks. Anytime we don't have one scheduled, we had an opening that was on Wednesday. We just pop up in a location. So for example, we went to Lawrence Street, right by the baseball field, across from Brothers Pizza there. And we just popped up a clinic, and we had some success in getting some people vaccinated. What's amazing, we're often asked the question about, are people hesitant? And I think maybe there are some people that are hesitant, but when you look at the numbers, again, the eligible population, more than 50% has agreed to get vaccinated. And that 50 plus population, more than 80%, incredible numbers. So what we found is when we bring the vaccine to them, when we go to a business, they're willing to get vaccinated. And even more so, we're digging even deeper when we're at these pop-up locations. I think, forgive me if I'm repeating myself to some of you. I know I might have mentioned this at another meeting, but one of the examples that I love, when we were at Broadway Liquors not too long ago, our lead nurse, Jamie Severino, she walked over to Checo Auto Repair, which is up on West Street, and just to knock on doors and lure people in and get more people vaccinated. And when she was in there, there was one person that was willing to get vaccinated after hearing what she had to say. And that one person convinced about 5 others who were sitting in the repair shop to get vaccinated. And that's the type of effort that we need in our community. And if we do that, and we will continue to do that, then people are open-minded to getting vaccinated. They see their friends and their family doing it. They hear about the benefits firsthand from one of our nurses. So that's the type of stuff. It's working. It's a grind for all the reasons, again, the social determinants that push us back, that we have to fight through. It's slowing us down, but it's working, and it's been a great effort. So I'll pause there. I know you had some other things, and I'm kind of going off with statistics and stories here, but I just want to refocus it on you, counselors, if you had any specific questions or lead me in another direction. You're on mute, counselor.
My apologies. Thank you, Director Armando. I do have a few questions, but I want to have allow my colleagues to ask them first. Counselors, any of you have questions?
Well, I'm going to ask a few questions through you, Mr. Chair.
Go ahead,
But
Counselor.
before we do that, I would like to go back to the actual reality that we have in the city of Lawrence, that not many of us, or not many people are still talking about, which is the positive testing. And I know that you mentioned that. I want to confirm a couple of things that I have to take some notes. So in Lawrence, so far we have more than 20,000 people that tested positive, correct?
That's correct.
And we are number one in in percentage of people getting tested and positive results?
Percent positivity is number one. That's the 4.46 rate, and the number of cases per day per capita. So everything is based off 100,000 population, even though we have 87 on the books.
And how many tests we have every day? How many we given every day? How many of those? How many tests? How many people were testing?
560 per day was reported during the last 2-week time frame.
So, and then what's the positivity rate currently that we're number one? Because if that's the
4.46.
case, and then the number should be a little higher compared to the amount of tests that we given every day. Not just. So what is the positivity rate that you mentioned that we number one?
4.46 is the rate.
Huh? 4.6?
4.46.
So what are we doing to make sure that people still getting tested? Because I mean, there is a lot of people that kind of like forget about it, and you know, things are getting better. But I mean, this is I have seen communities that, you know, they have a second round of COVID positive tests, and the community was prepared at one point, but not anymore. And not, you know, it's difficult to get people back on track. So what are we doing for us not to, other than getting people vaccinated, what are we doing to enforce that, you know, we don't lose control here?
So one thing, not necessarily that we're doing, but what the Commonwealth is doing, they're keeping their Stop the Spread initiative, which is their testing initiative, funded and open through the end of September. So that allows us to keep filtering people to testing sites. One of the most important populations that we want to get tested are people who are close contacts with positive patients, especially where they're not vaccinated. So if somebody's not vaccinated and they were in close contact, the recommendation is to get tested. So in order to make sure that happens, we're continuing our case tracing efforts, which is probably a phrase we haven't heard in a while because we've been so focused on vaccinations. But in fact, it is still going on. We still have case tracers here at City Hall. And when there's a case that comes in every day, we call up those close contacts and we encourage them to either quarantine and or get tested.
Yeah, because the thing is like, if you get in contact with somebody that has been positive to COVID-19, you won't be able to get the vaccine right away.
Yeah, there could be, depending on if you're sick or what the time frame is, you may not get the vaccine right away if you're positive.
Yeah. So another thing that I would like to bring up, and I'm gonna keep on talking about it, you know, the site, the testing site. We used to have one at the Fruteria. We don't have it anymore. We used to have the drive-through. I don't see that function anymore. I know that we have one at the senior center, but that information is not quite getting there. Perhaps, in my case, I'll tell you my story. I mean, I need to get tested for my own knowledge. And at one point I wasn't able to get tested because I was limited on hours. And I went to CVS and get a at-home test, a home test, COVID testing, the one that you use at home, and we did it at home. It was negative, but it was some limited on that. And then if we just focusing on vaccination and we forgot about, you know, where to have or where people have access, because it's more about, I know that the availability is there, but sometimes people don't know where they are anymore because they go to two places that they used to be, and they're not available anymore. And if you go to the hospital, which happened to me personally, I went over and they were telling me, oh, you need to be seen by a doctor first, and this and that, bunch of things. I just went to CVS, you know, get a at home test, and I did it, and it was all negative, all fine, good, perfect. But you have to, we have to keep on spreading the word that we have vaccination side. We have, COVID-19 testing site. And if there are, I know there are one at senior center, but what are the other ones? Like, that information is not up there anymore. And that's important if we keep on pushing on that, because I mean, there is people that's a reality. A lot of people, they hesitant, and they need to keep them, getting tested if we don't want the virus to keep on spreading.
That's great feedback, Counselor. I appreciate that. That's been one of our biggest struggles, is to maintain the lines of communication and just get that information out there. I'll check what we have on the city website and social media. Right now, we should have, there should be testing available at Manchester at La Fruteria. The senior center will be gone with testing, but there should be, I'm not sure why that wasn't available when you went.
No, because of limited on time.
Okay, I understand.
That's open. I get tested a couple of times there, and that's still on. But I mean, the other two, I mean, the most common one, it was the drive-through, where everybody knew what it was. Traffic jam was to the top there, but at least people knew that, oh, okay, you can get in your car and get down there, and you will get tested. You will get tested. But I mean, they're no longer there. I don't see it. I don't see it anymore. I don't know if it's still available. But I mean, we want to make sure with that we still, people knows that if it is at the senior center, if it is another one's available somewhere around, and if it is in the hospital or the clinics around, how can people get that information, and what's the procedure for them to go? Because it's slightly different than before. I remember when everything started, you just walk into the hospital and they have some type of site on the site that you can get tested. But now you need to see a doctor, and through the emergency room, perhaps. That's the process they have. You need to see a doctor. You need to wait on the waiting room, on the emergency room, and stuff like that. It's not quite as convenient. Things have changed a little bit. People don't know, and people get discouraged when they get new information as different than before. I mean, I understand the efforts more to get vaccinated, but like I say, I go back to the hesitance. It's probably in a small amount of cases, but so far we have only 41% of the community that have been vaccinated. So the other 59% still up there. And if we think it through, we are close to 100,000. That's 59,000 people that haven't been vaccinated. So it's greater than the one that are vaccinated sometime. I mean, right now. And I know, kids and stuff like that is different, but still, in general, I think that we should make sure people knows that they still can get tested as easy as before, and where those locations are and stuff like that.
Yeah, it's definitely slowing down a little bit on the testing front. Like you said, there's been a lot of focus on vaccinations, but it's still available. But really great feedback. I appreciate what you're saying and your personal experience. So we'll definitely see if we can focus more on that and see what we can get for resources to make that a better process.
Yeah, and the thing is like, even though if people are fully vaccinated, requirements to get tested are up there. If you want to travel, if you want to go for many different things, you need a test. Even though you're fully vaccinated, they don't take that hard as proof of you not getting COVID. It's the test, the negative test that they're looking for.
Any other questions?
Yes, Ms.
Councilor Levy?
Through you, Mr. Chairman. You said that we are going to close the station that's for vaccination in the next 2 weeks.
We are not closing vaccinations. There's some that will close. I believe the senior center will be closed for, I'm sorry, you're saying vaccinations or testing?
Both of them.
Okay, so for testing, the senior center will I believe will be not testing, but La Fruteria will be open and LGH at the tent will be open. Of course, you can get tested at the emergency room at 25 Marsden Street. There's lots of places to get tested, but the Stop the Spread initiative, the free initiative, will continue through the end of September. The vaccination sites, we are not closing any extensions. The Arlington School will remain open 9 to 5, Monday through Saturday. City Hall will remain open Monday through Saturday. Pop-up clinics will continue, and you'll see our mobile testing unit. I didn't mention that. You'll see that a week at a time in different locations.
Testing unit or vaccination unit?
It's I should say we used it for testing, so I have that stuck in my head, but we're going to be using it for vaccinations. Thank you for clarifying. So we'll call it the mobile vaccination unit you'll see around the city.
So the one that is practically right across the General Hospital, that one is going to be closed, or is closed right now?
The Lawrence General Hospital, maybe this is what I said that.
And the parking lots?
The South Lawrence East School, we were vaccinating Monday through Saturday.
I'm talking about the testing place near to the Lawrence General Hospital.
The Lawrence General Hospital testing tent is still operating. What I had mentioned earlier, I don't know if this was confusing. Lawrence General Hospital at the South Lawrence East School doing the vaccinations was closing on Mondays and Tuesdays.
Oh,
so that I don't know if I confused.
Yes, that's then my.
Sorry about that.
Little confusion in there. Okay, so we're gonna keep it all the vaccination place. Plus, we got the bus that is coming to any place that people see. I want to have it like it over here. I can call and say, okay, let's do the vaccination today in front of my house. They can come in.
Yeah, we're going to have locations, and if you wanted to host a clinic and say come in front of my house, and you had a big group of people that could come, we would encourage you to do that.
Okay, and a couple of places for texting is going to be closed. Are going to be closed.
You might see a few less locations, but testing will continue till the end of September, and the locations may change, but. Right now, they're staying the same at La Fruteria and the LGH.
Yeah, we should keep it during the summertime because knowing, how people are right now, I know that's a lot of people who are already vaccinated, but still is unknown who is not vaccinated or he is not, having the COVID, and still is we are in the high labor. I think that we should keep doing all of the efforts that we are really doing so far to get people tested and vaccinated. Yep.
Absolutely.
That's my major recommendation. So hopefully, let's see if we can lower a little bit the data and here, and we can feel more free to be out and around. But what was the percent that still we have it in here in the city of Lawrence that you mentioned?
The percent positivity or the percent that we vaccinated?
No, the percent positivity.
The percent positivity is 4.46. So it's lower. It's, we were as high as 20. It's getting low, but it's still high.
That's the percentage of the people that are being tested.
No, that's the people who has the COVID.
The percent of the positive test results. So if you were tested, 4.46 of the people who are getting tested are actually positive.
Right. So it's not that it's 4% of the population.
Correct.
It's 4% of the people that are being tested. Councilor Levy, do you have any further questions?
No, I'm okay. Thank you so much.
Thank you, Councilor Levy. So, Director Armando, I think it would be great, if you provided us sort of through email just a list of the places where you could. I know that you've mentioned them on air, but just places where you could get tested. You did mention some places where you could be you could get tested in the vaccine, some are coming out. So I think, if you could send us whatever the most updated is, and also when things are occurring and there is a drastic change, informing us would be great, because I know all of us have fielded questions at some point or another. We fielded several questions that have sent people in different directions. So I think knowing whether or not they're there or not would be great. But before I ask, I have a few other questions, but before I ask them, I see that Councilor Reyes has her hands up. Councilor Reyes? Statement or question?
Thank you. Thank you. I have a couple questions because I receive a lot of phone call for our small business, also from our church. And personally, I want to know, we are already reopening our park in the city. What is the limit when the people be together at the same time? And also our small business want to know what is the new guideline after tomorrow.
So great question, Councilor Reyes. Since we are, Director Armando sort of divided his what he's been speaking on sort of like one sort of like the past, and then the next component he's going to be talking about what's going to happen, especially like during the summer once the governor's order. So before he gets into that, do you have any other questions around coronavirus preparedness up to this point?
No, Councilor Payano. Director Armando be specific and clear, and his dedication is amazing for us.
Great, I agree. So what we'll do, Councilor Reyes, is I have a couple of questions around sort of coronavirus preparedness, and then after we close on that, Director Armando can sort of talk about the second part, and I'll come back to you to see if you have any further questions. Is that okay?
That okay?
Okay. Awesome. Great. Thank you. Director Armando, so just to keep focusing on the corona preparedness part, I think the other part what I think would be important is for these pop-up, informing the council, and I think it's great that we're doing that now. I know Boston was doing that. They started doing that a couple of months ago, and I think you're right. Like doing the door-to-door and trying to get as many people from the community to come out is extremely important, extremely valuable. One of my biggest fears that I have, especially amongst, I think like the 20 and 30-year-olds, is that there's this fear of the virus. It might not mean fear of the vaccine. It might not come out as I'm afraid of the vaccine, but it's like the vaccine is going to cause issues. I don't think Johnson & Johnson did us any a good service, but there's definitely this fear as to what will this vaccine do 20 years from now, 10 years from now. Like, do I really need to? Stuff right now with the governor opening up, I've found that instead of it making more people want to be vaccinated, they are sort of saying like, well, if we're opening up, that means this is going away, and essentially coming up with reasons to not be vaccinated. So I like that there's this approach that's being done. The weekend, I think is great, and getting community members to come forward. I think I just want to sort of say like to use us as everybody here, everybody in the council is a community leader, and they have individuals that they can sort of help sort of push this message along, because I feel like it hasn't really reached a majority of people. Like, people are not thinking about the vaccine or even the virus as they were a month and a half ago. So like, I'm wondering sort of, how does the city gauge success on a weekly basis, and at what point do we decide to try something different? Seeing in the paper that we're still a red zone, whereas everywhere else is not, is it's not what you would want to see. And like the Globe came up with an article a few days ago where it showed us that we were in the red, and I finally understood why my perception of things was so different than everybody else's. Because in Lawrence, I don't think that we're ready, right? But that's because we're not. Like still hot zone, and our vaccine rates are lower than everybody else's. But if you live in a community where 60-70% are vaccinated, and testing is low and positivity rate is low, then you probably think like, what are we still waiting on? So my fear is that we start, the state sort of, that we might get left behind. The mention that you said that some of this dollars ends in September. Hopefully we're ready to go in September. But if we are, if we're slow on the getting the vaccine, I wonder how we'll get there. And that's not even talking about. I'm told that for some of the shots you need a 6-month booster. So like that's a whole separate thing. So yes. I said a lot. I'm wondering if there's a response there.
Sure. Oh man, so much to say. First thing I want to tell you is I feel the fear that you are describing. I feel the same way. I don't know what's going to come of this. Having gone through all of the efforts that we've gone through, it's scary to me that this may not be over, and we have to keep fighting for everything, to get testing, to get vaccine, to get that message out to our community. What gives me hope is looking at the data on a weekly basis. One of the reasons I use the first shot data as opposed to completely vaccinated is because I know that we were a little bit behind in the community. And I wanted to both really give some inspiration to my staff and give some hope to myself and say, all right, is this working? All the efforts, everything we're doing every day, are we making a difference? So I watch the data closely personally. Just today, I was crunching, what did we do in that age bracket that you spoke of? Is that also climbing at a rate of 2.4 to 3.0 every week? And in fact, that specific age group that you spoke of, the 20 to 30, forget the exact number, was just about 2.4, right on pace. There was the higher population, 30 to 50, was even higher, 3.6. So people are still getting vaccinated, and that gives me hope, because it tells me that, and that's been the same rate again for about 11 weeks with slow and steady 3%. So the message is still getting out there. It's just a little bit harder for us. We can't sit back at a mass vaccination site and watch people come in. But we knew that from the beginning. When we started opening up mass vaccination sites, I sat with my colleague, Director Martha Velez, and we would advocate to our partners in the community and say, we have to do more. We got to get ready. We're going to have to go out into the community. We want to make sure that everybody understands what it's going to take to do this grassroots work. And we're finally at that place now. So I look at, I'm looking at the data next to me here, 20 to 29-year-olds, 31% has gotten one vaccine. And again, it's a fairly new eligible group. 16 to 19-year-olds is 25% have started it. So 1/4 of our 16 to 19-year-olds. The lower group is the 12 to 15, which literally just became eligible. That's 3.49. So we look at things like that, and we just develop strategies. We're working with the school system right now to get in and try to vaccinate students. We held a clinic at Lawrence High last Friday, had 51 students vaccinated that were seniors and on their way out. We wanted to catch them while we could. And then the efforts that we're talking about, we actually started pop-ups a while ago. One of the first pop-ups we did was at Vailbrook Apartments, and we went in a partnership with another agency that works with LGH, and we thought we were going to do 40 vaccines that day, and it multiplied, it doubled to about 80 because word started to spread. And that was the first thing that gave us hope. We said, wow, this is going to work, but we just have to get into the door. Then a few weeks later, we went to an auto repair shop on Jackson Street, and the owner of that shop wanted to host one of our first business vaccination clinics. And he did it in honor of a gentleman who lost his leg due to COVID-19 complications. So he did it as a fundraiser and brought the community together. And we did just about 50 vaccines just from one person who wanted to bring his friends and family and customers together. And that's when we knew we definitely had a recipe for success, and we haven't stopped since then. So we're getting more organized with it. It's becoming a daily thing. We have people who are more interested. We just got to spread the word and let people know, to your point, Counselor, it's not over. We have a lot of work to do, and we don't know what the future holds. There could be a booster. There are definitely variants. Just the fact that you had COVID-19 doesn't make you immune from the variants that can come in. All these reasons why it's so important to get vaccinated. So we're going to continue the efforts. We want to take some lessons learned, and we want to keep this going, even when, you know, as funding starts to run out. We want to preserve as much as we can. If we can get grant money and keep a couple nurses on board just to keep a vaccination clinic. We have some infrastructure. We have high efficiency, not efficiency, but medical grade freezers and medical grade refrigerators, tons of supplies that we purchased due to these efforts to carry us through the year if need be. And hopefully we can build on this. Hopefully not just our community, but the Commonwealth. I think they recognize, again, all those social determinants, all the things that make it so difficult for cities like ours to get our community healthy. And that's, I think, why we saw things happen with Governor Baker declaring the 20 equity communities, because it's about equity, and we desperately need equity. We have to fight against all of these health inequities. And I think that was finally recognized. Unfortunately, it was recognized in the hard way with what COVID-19 did to our community. But we have to keep advocating for those things. So when we're on calls, right now, the great thing about COVID-19 technology, if I can call it that, it taught us to use these meetings, these Zoom meetings. And I'm on a weekly call with my colleagues in the region who are public health directors, as well as the 14 large cities once a week. And we have the great opportunity to advocate to some of the leadership at DPH who sit on the call and are very interested to hear what the 14 large cities have to say. So I do these, I advocate, Martha Velez advocates all the time, and that's what it's about. We need to get into our community, see what the real needs are, and make sure that the leadership in the Commonwealth knows what our community needs. And so, as you know, sometimes they don't always know, but they're learning, because we're not going to stop telling them.
Thank you, Director Romano, for that. And I think just kind of moving on our conversation to, you know, that second piece, which is what happens now. You know, as far as the governor is rescinding the order, we have a local order in place. Does that still remain? Are there plans for it to be removed? As Councilor Reyes mentioned, you know, she had a question around not just that, but also our parks, you know, and other measures. I would say that there is one of the things that we, I know you sent us a memo about, was we had a question around the school, because I think that one of the big question in the last month and a half, month and a half is, you know, if the kids can be can go to school and be, you know, away from each other by 3 feet, then why aren't the parks opened? And, you know, why do we still have the 6 feet mandate in place? I think now what we're going to hear is, if there's, if the governor in the next couple of weeks is opening the parks, why haven't we, I mean, is getting rid of the mandate, why haven't we opened the parks already? And also, you know, is there a reason for us to retain the 6 feet distance, the mask distance, when the other restaurants in the area are more likely than not going to be doing that? You know, so I'm not even talking New Hampshire, because, you know, there's a lot of folks going to New Hampshire and just for the quote unquote freedom that they can't get in Massachusetts. But if you can go to Methuen, Andover, you know, and just the local communities, and, you know, the policies there are completely different than ours, I think that that's going to hurt our business community. I don't know how much having these policies that are only limited to us really help with our numbers. So essentially, if you can talk about our local policies, you know, if you have any knowledge as to, you know, when you feel like parks can be reopened and folks can, you know, where we can say like people can start sort of getting back to normal.
Great insight. So as we speak right now, in fact, I'll be joining over at the library. We have a group of licensees who have alcohol licenses, business leaders, business owners, I should say. And there's going to be some announcements made there tonight. We just literally came to some conclusions on what we were going to do to move forward. So I believe the mayor is actually on his way over to the library as we speak. But to answer your question, we have about 8 orders that are both joint executive and Board of Health, and 2 Board of Health orders that we've scripted over the past year. All of those orders essentially will at some point become rescinded. It will likely be in the next day or so. We're finalizing those documents, but at the same time, there will be some things that will stand. So I don't have all the details, but to sum it up for you, and literally, we just are finalizing these conversations. It is the intent of the Board of Health and the administration to get the city open again. So we want to do that obviously as safely as possible. The vaccination rates are very encouraging. We still have a lot of work to do. We're prepared to continue with that work. The testing rates are dropping, although we're the highest in the Commonwealth. They're dropping. And I think, to your point, you hit the nail on the head. When you script these restrictions and you create orders, you have to be very mindful, of course, to what the public health purpose is. So if you're putting a burden on a business, what's the end goal in that? And public health and communicable disease is not just a municipality thing, it's a community thing. It spreads across borders. It obviously spreads across state and international borders as well. And we are a very heavily traveled city. We're a busy city, and we have our residents and our customers will go to other municipalities. They would go out to eat in restaurants. They'll go to other parks. They'll play other sports. And all of these things are things that we think about when we make decisions on whether we should maintain restrictions or not. So I think in general, I can give you the general idea of where we're going, and it is to reopen the city. You will probably see some things like mask requirements indoors and hand sanitizer and hand washing stations to be maintained in certain businesses. But the intention is to open up with the Commonwealth, mostly really for the reason that there's no great, tremendous public health purpose at this point to maintain certain restrictions. So we are mindful of that. There's going to be a lot more to come, but I think that's what the city can expect, and you're going to see that in the near future. Things like parks, they're going to take a little bit of time to reopen, but not too much time. So because we're concentrating so much on our vaccination efforts, Martha Velez, our Director of Health and Human Services, also operates the recreational department. So she's putting a lot of time and effort into vaccination efforts and sending the mobile unit around and working with us over here in the Board of Health ISD. So we're pulled in a lot of directions. So again, we're a little bit behind in getting things launched, but I think we're at that place now where we still have to work very hard. And the focus really has to be, I think, like you said, Council Payano, people have to realize that although we're opening up, this COVID-19 is still very real. It's just we're making decisions based on the fact that we're getting vaccinated, but we have to keep getting vaccinated. And if 6 months from now, there's a booster and we're worried about variants, we have to be mindful that we have to stick together as a community and get that booster shot if there so should be one. So it's going to be a constant battle, as it always is in our community, to make sure that we're healthy. But we're prepared for that fight. We have to fight hard to get our businesses back operating and get our community back up and running.
Great. Councilor Reyes, I know you had questions about the park. Director Armano just gave an answer. I don't know if you have any follow-ups.
Sorry, Councilor Payano. I'm driving right now, Boston to Loren. It's raining.
Sure. My apologies. So, Councilor Reyes, so the Director Armano, essentially, you had a question around the parks, and he mentioned that essentially that it's going to take some time for the parks to reopen, but he believes that it should be soon. Dr. Romano, am I saying that correctly?
Yeah, that is correct. Some things have started to open up, and Director Velez has been working very hard to get the process in place, and even so much so where you're going to start to see online applications. It's one of the last things we did in the city for online services, so that is coming very soon.
So, Councilor Ray, I just wanted to hear if you had any follow-ups to that.
Yes, please. I want to know when they put in play, because the people in our community call us and we would like to have the respond to them.
So, Director Romano, is there a date that you know of?
Depending on what the activity is, some things are ready to go now. My understanding is there's already some sports teams that are booking parks and playing in them. So there's things that are happening right now. I think the appropriate response would be to contact Director Martha Velez and Health and Human Services Recreational Department, and she will start the process and get people at least maybe some timelines depending on their activity.
Councilor Reyes?
Thank you.
Are there any other questions from councilors? Councilor Levy?
Yes, through you.
Go ahead, Councilor Levy.
Okay, through you, Mr. Chairman. What about the mask? Are we going to continue? I know that the mask is going to be, I think that Friday is going to be everybody can be outside without the mask. Are we going to continue using the mask in here with the same restriction?
Yeah, the direction that we're heading in is so as long as we're in the high risk category and cases are still coming in, we will continue our mask order, which is an indoor, for the most part, an indoor restriction. So masks should be worn indoors and in some outdoor locations, like at a gas station. Again, there might be some details that will change here and there, but that's the direction that we're heading in.
Councilor Levy?
Yes, because I'm having I'm having a few phone calls regarding the mask and say, well, nobody has to use the mask. They think so on the 29th is that the restriction is going to be taken over. But in here in Lawrence, are we going to continue with the restriction that somebody get fined, the $500, or just only for the inside, or also it's going to continue with people using the masks outside?
Yes, this would be in public places. So we did have an order that lined up with the Commonwealth's order where masks had to be worn even in private residence with gatherings. And at some point, the administration ordered where there was a noise violation, if there was found to be a gathering without masks, we were issuing citations for that activity. That is no longer an order. That was rescinded by the Commonwealth. So we do not have anything like that. But for masks in public places, so as long as we're in a high risk category, we're heading in the direction of keeping that in place.
So we have the right just to say to someone that is not using the mask outside and say, okay, still the restriction is not over here in the city of Lawrence.
Outside, there would be no restriction, or there would be no.
Outside is no restriction starting on the 29th.
Unless you're in a gas station.
Correct.
So only public places. So Director Romano, so if I'm at a park watching a softball game, will I have to wear a mask? You would not. Basically, this order would, if you may or may not, I'm sure you.
So I'm so disappointed with that.
It lines up with our mask order. I believe it was order number 3 of 2020, which
were a lot of orders.
Were a lot of orders, but that's where it is. And again, more to come on this. We're working to essentially sort of start fresh with the orders so that the public can better understand. So essentially, everything would be rescinded, and we'll have one clean order with the things that are kept. And that's coming soon.
Dr. Romano, are these orders going to be discussed at the Board of Health, at a Board of Health meeting? Are they being discussed internally? Like, at what point do we get to hear like the logic behind some of this? I'll say that during the crisis, sometimes there were some orders that were put in place that I did not see that in a Board of Health meeting, but we were in a crisis, emergency situation. great. I think that we are moving away from these types of moments. So I think that it is important for us to be sort of transparent in the way that we're moving forward. That being said, I think, not just with the Board of Health policies, but if there are changes being done, that are under your purview, whether it's released to the public tomorrow or a week from now, if we have knowledge beforehand, I think that it definitely will help all the members. One of the things that is sometimes the most upsetting is when a resident or reporter or anybody's asking questions about something that just occurred, was released at 10 a.m. and it's 10:30. You're like, what? Like, I didn't realize we were even moving in that direction. So I think it's important, that for us to be like really great partners. The more information that the council has on the way that the city is moving, the better we can inform our residents. It sounds like for some of these policies, there's still some work to be done. I'm hearing that you're saying that there's some policies going to be announced today at the liquor license meeting. I think it would be great, tomorrow for us to get an email finding out what those policies were. And if any other changes like that, I'm sure, all of us would be in this public safety meeting, so we wouldn't be able to go to the meeting today. But if this meeting wasn't going on, I'm sure many of us would have wanted to be there and just kind of hear what this, this new thing is. So please keep that in mind. That being said, are there any other questions? No, Director Armano, well, thank you. But before I let you go, there are some other items that we probably won't be discussing tonight. I know that you have another meeting to attend to, but there's the question about doing a report around I think the ordinance says that Councilor Rodriguez, is it to talk about what
that and then I can go.
Okay, so the ordinance says that there should be a report from well, I forget exactly.
The chairman of the Board of Health.
The chairman of the Board of Health. There we go. So I think, it doesn't necessarily have to be written by the chairman of the Board of Health, but I do think that there should be something coming from your office. It doesn't have to be tomorrow, a week from now, a month from now, but basically kind of giving us an idea, or giving the city an idea of what the Board of Health is doing. For the last year and a half, there's been a focus on obviously the coronavirus preparedness, but just like moving forward, I think it's important. It's one part. It's a part of the city that no one really pays attention to until a huge crisis, right? So we want to make sure, in order to make sure that those types, that the agency is, well funded and folks are, constantly thinking about it. I think it's important for people to be educated in what they do, and also because it's, and the sort of like how it interrelates with inspectional services. So just wanted to put that in your radar. Councilor Rodriguez.
Yes, I have a quick question of a comment that Director Armano just mentioned. Can you talk a little bit about the reinforcement shot that is coming up? And if you can send us some information, and that way we can get more educated officially.
Rodriguez, you said reinforcement shot, the booster shot?
The booster shot, yeah.
Okay.
Yeah, I act, just to be clear, I don't have any information about a booster shot. I was speaking it in the reference of it as a possibility.
Okay.
But yeah, there's nothing on that. Thank you for clarifying.
No problem. I want to make sure that if it is any information about that stuff, that we can get it firsthand, and not just based on a search on the internet and stuff like that. It's better off to have the right information and spread the right information.
Absolutely. And Chairman Payano, I appreciate so much. Obviously, doing the report, things are driven, the Board of Health is driven through Inspectional Services Department. I did get your email, or I believe I replied. If I didn't, I apologize, but I'm aware that you're looking for the report. I spoke with Dr. Bourne about a report that will likely be prepared through my office. We are a little bit short on resources, so I appreciate your patience. I love the fact that you want a report. I'm passionate about what we do here, and I agree with you wholeheartedly. I think the city doesn't completely, may not completely understand the connection of how, what the health issues are, from housing to communicable diseases to food inspections, all these things, vaccination efforts. They're things that we've done for a long time, but they're not often publicized. So I'm very grateful that that you invite me to these meetings and you give me the opportunity to speak. And I encourage you to share any reports, data. Feel free to share the data that I send for vaccinations or case tracing, and I'll work on a more comprehensive report, and excited to do so.
Well, thank you, Director Amato. Thank you, your office, everybody that's been part of the team, ensuring that that Lawrence is as prepared and that we're vaccinating people. So thank you so much for your service. And as far as the report, as long as I think we've been looking up for it for a bit. So I think at this point is like whenever you're able to, right? So even if it comes 3 months from now, I think members of this committee are fine with a date like that, so we can connect further on. So thank you so much, and I hope you have a good evening.
Thank you so much. Have a good night, everyone.
Councilors, would you like to make a motion? Anyone would like to make a motion to table?
Motion to table?
Second.
The motion to table is a second. We will do a roll call vote. Councilor Reyes.
Yes.
Councilor Levy.
Yes.
Councilor Rodriguez.
Yes.
The chair votes in the affirmative. Councilor, is there any other item you would like to take off of table matters?
That is through you, Mr. Chair.
Go ahead, Councilor Rodriguez.
Do you have anything on mind that we should be discussing?
Yes. So one second. There was there was a motion, but here we go. Item 188-18, City Hall security and safety.
Motion so move on that to take it out of the table matters.
Is there a second?
Second.
So it's been second. Now let's do a roll call vote. Councilor Rodriguez.
Yes.
Councilor Reyes.
Yes.
Councilor Levy.
Yes.
The chair votes in affirmative. All right, so we are now on that item. As you saw, the chief of police sent back a memo to us. So I just wanted to ask that everyone had the opportunity to look at it.
Yes.
Yes. Okay. So I think that one of the pieces that we were talking about is setting up a meeting with the mayor to fully discuss this. I believe Councilor Rodriguez and Councilor Levy, you were.
No, that was something else. It was not this item.
It was not this item?
No, it was more like the item to be prepared in case we have an emergency in the city.
Right. That is this item.
No, this is about the security at City Hall.
Right.
That was
so
the item that you mentioned, right?
Oh, so yeah. So your task was on security of what?
No, that our task was more like the emergency preparedness of the city of Lawrence in case something like Columbia gas or the gas explosion happen again.
I think so. That is. I'm sorry for the interruption.
Go ahead, Councilor.
Yes, through you, Mr. Shiva, and I think so that I understood, not just only on case that, we have something like that's the gas, but any other problem that could arise in the city. So like as you can see today, a guy came in and killed 9 people in some places. So I think so that we need to speak about security issue anyway.
Okay, so Councilor, so I think that there was a question before where we were trying to get some information around that. Is there anything else that you would like to do on this particular matter?
Well, on this item, in terms of the security for City Hall, we are in section. Because I mean, that's the question mostly, and I think that Miss Maria de la Cruz, when she sent this item to the agenda, the intention was that what do we do in case something like happen or passing 5 o'clock when we have all the business in City Hall, that the City Hall basically empty and there is only a few people, but the doors are wide open for public to come. And essentially the response that we get today was related to the effort that the police is doing, including a police officer during the pandemic and the reopening of City Hall that is on site all the time. But the question will be more like related to when other business are happening in City Hall that are not quite as busy as during the day, essentially. And
So Councilor Rodriguez, I think maybe it'll be helpful for the public since for me to just read the letter that we got from Chief Ask. So it's addressed to Councilor de la Cruz, but it was sent to all of us. The Lawrence Police Department, as part of our routine patrol function, conducts extra patrols around all city properties, including City Hall. Since the reopening of City Hall during the pandemic, there has been a police officer assigned in the building during normal business hours. Additionally, there is a surveillance video throughout the interior of the building. Similarly, there are citywide cameras in the immediate proximity of the building. If and when there are evening meetings, oftentimes members of the police department are present to represent the department on a variety of topics. In the event there is a topic on any agenda that causes a larger than normal crowd to be present, or if there is information regarding a threat, a police officer is assigned to be present during the meeting. The department is also available for immediate emergency dispatch to City Hall for any 911 calls. I hope this information is helpful, and always, should you need any further, do not hesitate to contact me. So we got a response from the Lawrence Police Department. Is there any other questions that we may have?
I'm through you, Mr. Chair.
Go ahead, Councilor Rodriguez.
I'm good with the answer. I mean, I'm fine in general. Obviously, there is concerns for the type of business we do, but we know that we are in a city that we need to keep on focusing on the education piece of the work we do, and people need to people will definitely understand about in general the safety of the city and the safety of the City Hall. I'm fine with the answer, definitely. I wish Councilor de la Cruz get her answer on this letter. In general, but I'm good with it. I think that we should be sending this document to the full council for all the councilors to review it. And probably
is there a motion, Councilor Rodriguez, to send it to the full council as a committee report?
Yes, I have a motion.
There's a motion. There's a motion on the floor, second by Councilor Levy. We'll do a roll call vote. Councilor Reyes. Councilor Reyes. Councilor Levy.
Yes.
Councilor Rodriguez.
Yes.
The chair will send affirmative.
I come back, Councilor Payano.
Let's do Councilor Reyes again.
My voice, yes.
All right, perfect. All right, so unanimous, sent to the full council as a committee report. Councilors, are there any other items that you would like to take up? If not, is there a motion to adjourn?
Motion to adjourn.
Second.
So there's a motion to adjourn by Councilor Levy, second by Councilor Rodriguez. Roll call vote. Councilor Rodriguez.
Yes.
Councilor Reyes.
Yes.
Councilor Levy.
Yes.
Chair votes in affirmative. Thank you, everybody, and have a great night.
Thank you.
Thank you. Good night.